Hey everybody, I wanted to thank you so much for praying for me when you look at my new look, like my accessory. When I wear my mask out, it's funny, people, like do a double take and then they don't want to stare and whatever, but I think they secretly think I have the bird flu, and now this is going to be a major conversation topic. I saw the brain surgeon today. Today was a doozy of a day. I'm very exhausted. The kids and I left at about 6 o'clock this morning. We went to Hendersonville, North Carolina, had a 2-hour doctor appointment with a surgeon where he did all this neurological stuff and testing, and he went through my MRI with me and explained things, and the guy's amazing. And then we drove home back to Georgia, so it's been a very long day and mentally quite straining because of the whole to have brain surgery or not to have brain surgery. So in the end, what he told me, looking through the MRI and everything else, he's going to do another one to get a little bit more information, but basically, I'm so used to going to doctors and hearing things like, considering what you have, you may have to just get used to the idea of being on narcotics for the rest of your life. Or I've heard, you are my most complicated patient and I don't know what else to do for you. Or I have heard, I've gotten patted on the shoulder and given papers on depression, which is enough to make you feel depressed. I've had them tell me, what I'm doing is not helping you, it's actually making it worse. I'm going to stop, you need to go see someone else. I've had them basically kind of just say, I don't know how you function, and I don't know what to do, and, the test came back normal, everything came back normal, and what does all this mean? I'm used to doctors like that for the past 20 plus years, me having to do my own research. I have to go and try and convince them, let's test for this, or I have to tell them stuff, or they're looking it up on their computer, and today I got to go and see a specialized neurosurgeon who showed me pictures and told me stuff I didn't know, and basically explained symptoms I have had all the way since I was 5 years old, explaining weird things that just, had never made sense before and never all been put together, and for once, here's this picture of what's actually wrong with you, and yes, it's legitimate, and yes, it's real, and then he said he could help me. He started telling me about some of his patients that their asthma symptoms got better, or their pain levels got better, or these other things got better, and this, that, and the other, and going off your meds, and just all of this impossible possibilities. And basically, for the first time in years, instead of trying to just accept this downward spiral that I'm on towards disability, there is actually hope of maybe stopping that and maybe even turning around and heading the other direction. So what does that all mean? It means brain surgery. And I'm not going to say I'm excited about it, because who would be? And I'm not going to say I'm not nervous about it. But we prayed so much. My biggest prayer for today was that it would be clear. And it was very, very clear. So what he wants to do is called a decompression surgery, which is different than some of the stuff I had researched where they put rods and stuff in your upper cervical bones, and then they kind of like put metal stuff shoving your skull and all this kind of stuff. That's not what he's going to do, which is really nice. What he is going to do is basically the two top bones, the C1 and the C2, and then the skull, it's the skull that's compressing everything, and he's kind of saying, this is what it's supposed to be like in your spine so that the nerves and the messages can get through to your whole body and service your body and do what it needs to do. He said, and yours is kind of like this. And he actually showed me pictures of a surgery that he did on someone, pictures from the inside, and there were parts that were like, if you touch your skin and pull it away, how it's all pale because it's not getting blood flow, or like if you put a tourniquet on and it stops the blood flow, your arm's going to fall off because you can't function without blood flow. And there were sections that were actually all white like that, like egg yolks. And then after he took away the compression, he said, now this is what it looked like after a few minutes, and it was like you could see the blood and the little veins and all this kind of stuff. It was being restored, and it was, going back to functioning again, and there's just all these possibilities. And of course, he's saying it's not going to fix everything, but my thought was if it fixes anything, that would be just huge. If it even makes a difference in my pain levels, that would be really, really amazing. So I'm going to be having brain surgery on October 11th, which is less than a month away. And so if you have been praying for me, please don't stop, because I haven't had it yet. So it looks like you have to wear this until then, because it's kind of mimicking that pulling up and taking the pressure off. And so that's what we're looking at, October 11th, which, interestingly enough, I've got a brand new book that's getting released on October 10th, so it's going to be an interesting, maybe I'll be signing books in the hospital, I don't know. But I'll try to keep you posted on what's going on, and again, and just thanks so much for praying. I could see God's hand all over this, and it's really actually kind of exciting, as odd as it sounds. Instead of having a, oh my goodness, we're having brain surgery freak out event, we're going to have a party and we're going to celebrate. So we might as well, make the best of it, make it something good. And okay, that's until next time. Thank you, and I'll be in touch.